Okay, this is Fred here, and I'm at my 8-month post-op mark. Actually, it's a little over 8 months. I was a little busy. I was supposed to do it last week, but I didn't get a chance. Anyway, I decided to change the scenery. In my last video, somebody commented and said that the lighting was bad and couldn't truly see the results of my procedure, so I decided to do this in the bright California sun. So hopefully you'll get a better look at or a better view of my results. But anyway, I'll discuss. I want you to I'm going to zoom in here and show you the frontal part where I'm at. Okay, you know, you can see the density. The density is coming along nicely, and I'll show you. I'll comb it. I've noticed it's been like a little over a month, and from month to month, as I look back on the videos, I noticed there's an improvement in density. My hairline's pretty much pretty much completed. It's there, and let me show you. I'll show you the more. So let me show you this side here first. I'll show you this side. And zoom in on that, and you can see I could either comb to the side or I can slick it back. As far as shedding, let me do the other side as well. Okay, see this side? It's coming along nicely. This side is actually a little bit more dense, which is funny. The density initially was already thicker on this side. This side was thinner and balding more in the temporal area. And as a result, this one's a little speedier, and it's ahead of. It's about a month or two ahead of this side of my temporal area. But like I said, it's coming along nicely. Okay, let me show you before one more part, and you can zoom in on this. I'll show you my donor area. I show you every time, but I don't know if you could really zoom in and look closely. I mean, there's really no results. Let's see. I mean, there's no result of transplantation. There's no scarring at all, and it's healed. I think it's almost perfect. So I'm able to still keep my buzz cut as a result of the FUE transplant. The Cortez brothers did a pretty good job, and once again, I'll shout out and thank the Hair Medical Restoration. I might do it again at the end of the video. Let's see. Okay, somebody asked me if I was on minoxidil or any other hair medication, like Propecia. What's the other one? The minoxidil, Rogaine. Anything? I refuse to take any of that. I just rather have it. I don't want to take anything, or I don't want to put any bad stuff in my body. I don't want to have to rely on something where if I stop taking it, the results will go away. I just rather just stick with the results of the hair transplant. I think I mentioned in my last video, and I got a few comments about another hair transplant, and I think I'm gonna go ahead with another one. The reasons are pretty simple. I want more density, and I'll show you the areas that my frontal. I don't know. It's coming along pretty nicely, and I probably won't decide until I'm in another 4 months, 4 to 8 months. From the research I've done and what I've been told by various doctors, the density will continue to increase for up until 18 months after your procedure, and I still got a ways to go. So I'm not sure how much I want in the front, but there's certain areas you can see. I'll show you my back. It's a little thinner in here. It's kind of hard to see, but when it's wet, you could see. And then there's some area. There's a little bit of this area in here that's still a little thinner, which I didn't get any work done. I mean, the hair's still there, but I would just like to get overall density. And let's see. And then I'm thinking about even lowering my hairline just a bit. And I mean, maybe a quarter of an inch or half inch or a couple of centimeters. And another reason I might get it is to add some areas to the temporal areas. I'm not sure, and please comment and let me know what you think. If I should, definitely I'm going to get density, and I'm debating on whether I'm going to lower my hairline. I think I'm going to do that for sure. But filling my temporal areas, I'm not quite sure, because I've seen most results kind of look a little unnatural when you get the thicker hair in the side areas I don't know, it just doesn't look natural to me, and I'm not sure if I'm going to do that. I've seen some results online where they use the, I forgot what these, Napier hairs, I think they're called, down here, and sometimes they use that in these areas and even the front to make it look more natural. So that is a possibility, but once again, let me know what you guys think. And let's see. Oh yeah, and then one last thing I'm going to show you. I couldn't find my spray bottle, so I'm just going to use a little water. And I'll show you what it looks like when it's wet, so you can get a better idea of the density. Okay, that's pretty wet. So, and I'll comb it. So now look at the front again. Now that it's wet, it's coming along nicely. These areas. And I'll show you the side. This side first. Zoom in there. Okay, and then I'll look at this side. The density is almost matches my my existing hair, where it's really thick, which is pretty much all of this area. And let's see, and then maybe you can see the back now. Let me wet the back a little bit, and you can see why I want another procedure in the back area. When it's wet, you can tell. When it's dry, it's almost unnoticeable, but I notice, and that's important. Okay, let me show you the back real quick. Well, it's wet. You can see it's a little thinner in this area, and that's the main reason why I want to get some density in here, a little bit here on the sides, and then possibly a lower in the hairline. Anyway, that's my update, so I'll see you guys next month, and until then, please comment and hit that like button and subscribe so I can keep posting these videos. Alright, and once again, last thing, special shout out to Air Medical Restoration and Qunomedical and the Cortez brothers. Talk to you later.